Good afternoon, everyone, and welcome to our webinar on the COVID-19 crisis. We are very glad to have you here today with us. We have a list of distinguished panelists. Myself, Patrick Maléjac, I don't know if I'm distinguished, Secretary General of PIARC, the World Road Association, Héctor Ovalle Mendivil from Mexico, Director of the COCONAL company, Tymon, who is the Executive Director of AASHTO in the U.S.A, Bill Halkias, who is the Managing Director and CEO of Attica Tollway Operations Authority in Greece, José Manuel Blanco Segara from MITMA in Spain, who is a secretary of one of our committees at PIARC, Mark-Henry Rubarenzya from Uganda, who's the head of research and development for network planning and engineering. He's also a member of a PIARC committee, and Christos Xenophontos from Rhode Island's DOT in the USA, who is the chair of one of our committee. Brief words of introduction. Basic rules for online meetings that we organize. Well, I hope you can see the visuals using a laptop, iPad, or other device with a screen. Please mute yourself and keep the video off during the presentations. This is meant to avoid background noises and connection overload. So don't be surprised if I sometimes act to terminate your video camera. If you want to ask a question or to make a proposal, that's really welcome. You are invited to use the chat feature of Zoom for that. It's a feature of Zoom. We will collect the questions and we will direct them during the Q&A session at the end of the session today after all presentations. Also, as you can read on the right side of the screen, be sure to have your full name and country displayed and not your phone number, for example, or any other information, because this will ensure that people know who you are, who they are interacting with, and they can even maybe direct questions to you based on who you are and what country you're based in. That's something you can do in Zoom. As you can see, you can click on the participants button on the Zoom window, then you hover around your mouse over your name and make a right click and then rename yourself. This is really something that we recommend for the good team atmosphere of this meeting. Additionally, well, you really are invited to ask questions or to raise an issue. It's encouraged, and we invite you to use the chat feature mostly, and not the Q&A button, the chat feature of Zoom, and send a message to all participants. This is really one of the options on the chat. That channel is monitored by Christos Xenophontos. That's very important. About your name in Zoom, as we said, first name, last name, country. This will foster interaction between participants. This seminar is being recorded, and we will make it public on PIARC's website and on our YouTube channel. So I hope you're comfortable with that. And if you're not, I think the best course of action would be to opt out of the webinar today. The key concept, now to the topic, is to focus on the short term. With the world going through a crisis and every day counts. We've seen that for quite a few months now. It's still the case. This is knowledge and practice that is maybe not yet confirmed as valid or effective that will be shared with you today because validation takes quite a bit of time. Evaluation does take a lot of time. This is something we are working on at PIARC, and I want to be sure that you are aware of that. A good idea now can save lives. This is why we're sharing these ideas. Can improve business resilience and could minimize disruption of service. So you're invited to, well, use a pinch of salt maybe and make your own best decision. We share knowledge, is what we do, but be careful. What works in one country may maybe not work in another. It really depends on you. This is why we have this disclaimer that explains that and presents that the ideas and examples shared here are for illustration only. So our speakers today, if you have just joined us, include myself, Secretary General of PIARC, Héctor Ovalle Mendivil from Mexico, Tymon from the USA, Bill Halkias from Greece, José Manuel Blanco Segara from Spain, who's also very actively involved in our COVID response team in PIARC, Mark-Henry Rubarenzya from Uganda, and Christos Xenophontos, who also is very actively involved in our activities on COVID-19. The agenda and structure of the meeting today will be a brief introduction to PIARC and to our work so far, panelists' presentations, that's really the core of today's session, then questions and answers, and then conclusion and next step very briefly. We're aiming to end this session in 2 hours, so that will be before 3 p.m. Paris time. So where are we now? First of all, PIARC, if you're not familiar with us, we were founded in 1909 as a non-profit, non-political association. PIARC is our new name. We also are sometimes called the World Road Association, that's fine. And our goal is to organize knowledge exchange on all matters related to roads and road transport. We are very proud to have 125 member governments, as well as some regions, groups, companies, and individuals as members. And we are, I think, the first global forum for the exchange of knowledge, policy, and practice on roads and road transport. We have key missions. They all relate to sharing knowledge. To be a forum, we have committee meetings, we have assembly meetings, we have webinars like today's webinar. This is what we really do and we've been doing for years and years. We organize these so as to facilitate discussions, but also so as to identify good practice and share these good practice at the international level. This is why we prepare reports, 1 per month on average, organize seminars, more than 1 every 2 months on average, etc. We really intend to consider within our activities the needs of low and middle income countries. We organize seminars there. We specifically ask those member countries for their needs, and we invite experts from those countries to take part in our activities. And we also, that's the 4th bullet point on the screen, we also design and promote tools for decision making. Of course, on matters related to roads and road transport. That includes HDM4 for road investments and road investments planning, as well as CURAG for the transportation of dangerous goods in tunnels. How do we do that? We mobilize the experience and knowledge of 1,200 experts from more than 80 countries in our committees and task forces. That covers road safety, investment, climate change adaptation, freight transport, network operations, you name it. You can, of course, check that on our website. Speaking of which, we have created a dedicated page there about the response to the COVID-19 crisis. There you can find the recordings of all the online seminars that we have organized, the PDF file of the presentations of these seminars, as well as existing technical reports that relate to the pandemic management. We have identified, thanks to the COVID response team, and I will introduce them at the end of the presentation today, a number of key issues to, well, let's start with the obvious, to ensure as far as possible the health and safety of employees and of road users. Some of the presentations today will talk about that. To respond to the impact on transportations. In many cases, we have seen a sharp drop in traffic levels. What does that mean? Is this an opportunity to accelerate road work? How do we deal with the financial consequences? We want to explore how we can maintain relationships and collaboration with customers, users, and other interested parties. We all have suppliers, we all have clients, we all have contractors and partners. How do we maintain that in a crisis? In other words, how do we maintain activity and continuity of service even when some employees are working from home, for example, or may be ill, or when it looks like traffic levels will never reach back what they once were? And how do we manage the impacts on the economy and supply chains? We've seen that. Budgets have dwindled all over the world. And also, how do we revive the economy after the crisis? Hopefully through road investments in roads, which have been proven to create jobs and to have a very positive effect on the economy in the long term. We also need to maintain security, including cyber security, in those circumstances. We've organized more than 20 webinars in English, French, and Spanish since March earlier this year. Many PIARC partner organizations have agreed to join us, and in our webinars. We are very, very thankful for that. And I direct you to the website. We have there the recordings. You have there the Q&A sessions. We have there the reports, etc., etc. 2 synthesis notes are available, as well as an article in our magazine. They are all available for free from our website. Please go there, please check them, and please ask us questions. Where are we now in the world? Our colleague Jonathan has produced these excellent slides. Well, we thought that we would now be in phase 2 or phase 3, right, with the crisis having subsidized in many countries in the world. Well, it turns out that this is not the case, unfortunately. And I'm speaking here from France, and we are seeing in France that many cases, the number of cases is increasing. That's not what we wanted to, where we wanted to be. And you have here diagrams that present the situation across regions, a number of statistics that show that we need to continue the work on this. So thank you very much to Jonathan Spear for those slides. A simple reminder, please turn off your microphone, everyone, except the panelists, of course. The first panelist will be Héctor Ovalle from Mexico. So please, everyone, turn off your microphone and turn off your camera and be ready to ask questions to every panelist. So Héctor, if you want to open your mic, that's welcome. Thank you.
Thank you, Patrick. Good day to everyone. Thank you again for the invitation. Well, let's move forward. One thing I wanted to stress today is even though we need to learn from the past, we have to keep our eyes on today and onto the future. So can we move to the next one, please, Patrick? This is who I am. I'm from Mexico, and Patrick already said everything. So the key discussion points. These were the points, the items that I want to stress this morning. They were obviously suggested by Patrick. So the first one is investment in roads. Is investment in roads a priority for the economic recovery? I would say definitely yes, though it's kind of complicated in the sense that all of the countries, if not most of them, are aiming the resources towards this health crisis. So moving forward is kind of difficult in that sense. Can we move to the next one, please? Although we need to have a way and a strategy, what the aim of Mexico's government is to invest in a continuous way in infrastructure, roughly in the amount of 25% of the GDP for the next 4 years. This sounds great, definitely. For 20 and 21, 28 road projects are budgeted to start. This is roughly $3.2 billion of total investment. But as I said before, this can only be achieved by the strong support of private investment. All of the projects that I just mentioned are under the PPP scheme. On a different, some of them are different schemes, but all of them are public-private partnerships. There's no other way those things can be implemented. As I said, most of the resources in every country are aimed towards the health crisis. So what is the important thing here is what is first? We aim for the health or we aim for the economic recovery? I would say first health and then the economic recovery. So we actually need a pretty clear path or a pretty clear strategy in order to face this. In the case of Mexico, the government and the public, and the private investors have decided to move towards this kind of schemes, which should be the best way to do so. So to be clear, that yes, it's a priority. So the next question was, have we evaluated the effectiveness of some of the measures that we deployed in an emergency? Yes, if we take into account an emergency, this health crisis that we've been living since December, some of the countries like ours face it in late March. Well, I would say yes, because of the measures that we've implemented. 3.3% of our people got the virus, and I mean within the company, not within the country. we think that's a pretty low ratio. We haven't, in the company, we haven't got a fatality yet. So that's good news as well. As we all know, we have to face first our people, then our users, and that's the way to move forward. Patrick talked about the traffic levels. Well, in April, we had a decrease of 40% versus the 2019. Now in September, we are only minus 15. So that's a pretty good recovery. That means things have to move forward, but we have to move forward with what we already know and what we already face. And sometimes it's a trial between errors and better ways to face everything. Can we move to the next one, please? The next one is what measures are we implementing to be ready to face a new wave of the pandemic? The first thing is, sadly, I don't know if it's sadly or not, but in Mexico, we haven't faced a new wave of pandemic. We haven't finished with the first one, as bad as and hard as it is. So we're staying with, at least in our group, we're staying with the same kind of operation and rationale behind this. As when someone shows any kind of symptoms, we have this immediate isolation. This actually is the same slide I presented back in June. The changes we've done are basically in how to avoid it. But yeah, whenever we have any kind of symptoms, there's the immediate isolation, as well as testing. And then as soon as possible, we have a traceability assessment and testing and isolation of those in that line or in that traceability assessment. And as well, disinfection of areas. The disinfection of areas is a constant thing that might be here to stay, as well as some other things. But as we all know, the hard thing with COVID is fortunately, most of the people don't present any symptoms. Unfortunately, it's hard to identify them. And that could lead to fatalities, which is the thing that we really want to avoid. So these are the measures we are implementing, as well as many others. But this is whenever we find either someone is showing any symptoms or someone actually says or stresses out that he or she has had contact with someone with COVID. This is the procedure that we normally do. The next one, please, Patrick. So what we have learned, well, basically, in spite of a cure and a vaccine, some things should and will remain. And this is basic. These three next things are basic items. I know that, but sometimes we lose face of those, or we just give them for granted. And one of them is cleanliness. The other is hygiene, and it's a broad aspect, I know, and regard for other people's safety. Even though we don't have a vaccine right now, we do have a physical vaccine, and face masks do actually work. And how do we know it? Well, there are several studies around the world, and personally, I've come in contact with several people that later I know that they do have COVID, and haven't got it. So, and the main reason is face masks, really. Others as well, but face masks are definitely a game changer here. And even though it might be bothersome to wear them, or it's not the easiest way, or the most comfortable way to be, well, they do save lives, which is the important thing. And we've also learned that, and this comes basically from Japan, we need to avoid closed spaces, crowded places, and close contact settings. So this is also a game changer for everyone in our industry, and I would say for everyone in the world, because we need to change our mindsets in order to try and control this thing. So even though these two very broad aspects are not, you can say, are not related with what we do, well, I think everyone can do so, or most of us can do so. And the more that can, the better for the world, actually. As a group, we have invested in COVID-related measures, roughly $3 million. This is important because of basically two things. The first one is we need to take care of everyone, or we need to take care of our people. And the second one, those things weren't considered in any of the contracts, whether it's construction or operation. Nobody could be ready for what we're living right now. So, and I would say that some of the first measures we're not using it. We're not using them right now, and that's because they didn't seem to be very reliable or effective. So we've migrated to others. But these basic issues is what we're doing right now. The next one, Patrick, please. So also common good practice, again, cleanliness and hygiene. What we do is a continuous vehicle rest area and office disinfection, constant communication and training in disinfection and how to avoid things. And the more we communicate with our people, the more we and them identify new opportunities or new areas where we should strengthen or change the way we do things. Again, and we've heard this so many times, but it actually helps: the proper distancing, the constant hand washing, and avoid face touching. So we'll see in a couple of pics after this slide how we do so. Well, people have to use the mask and the face shield. Some of them use gloves, but all of them use gel for disinfection. And what we need to achieve is people to use them either by conviction or because they're obligated obligated to do so. And also what we faced in many cases is that people from outside are, or in this case, users, whether they're users of the road in any sense, on the toll plazas or on the bathrooms or rest areas. Some people don't like to accept or won't accept the proper distancing, the use of face mask. And also, and a very important fact, that together things do happen, whether they're good or they're bad. But we need to stand together in this. And what has been the way we face people that are reluctant? Well, some of them we cannot do anything rather than just protect our people and at the same time protect them. Some are rude, some just don't listen, but our people or the people within the company have to use this or have to follow this kind of measures that have been taken by the whole group. Yes, they change because we're trying to aim to things that are more effective, but it needs to be a collective effort as well, because the final user in our group, or everyone in every stage or in every department has a better understanding of what they are doing and how they are living it. Therefore, their feedback is absolutely important. If we move to the next one, please, Patrick. These are images of how we are doing things. These are the toll booths, basically, as well as disinfection of the bathrooms. And I wanted to leave the one in the bottom right, because it's the last one is a roll call. Is the roll call in the way we perform it or do it early in the health crisis. This is a photo from April, basically. So yeah, with the distance and stuff, but it took time, and it was at the end of the day you had the roll caller and the guy or the girl that just came. But what we changed is in the top right, and it's a camera. It's a camera that measures your temperature, but also gets a glimpse of your face and gets the roll call. But the important thing with this is that it recognizes you whether you have a mask or not. Not if you use a face shield, it won't recognize you, but with the mask it does. So you don't need to touch anything, and you don't need to remove the mask. So that for us was makes it simpler, and we searched for this kind of technology because people kept saying, well, yes, we're doing everything, but at the end of the day, we have to touch something, or we have to go into a close encounter with someone. Even if we keep the distance with that someone, sometimes we don't hear each other, or it wasn't practical at all. But this has been helping us, whether it's operation or construction, or in the offices. The next one, please, Patrick. The next one is also disinfection, proper areas for that, proper areas for clean your in order for you to clean your hands or to step on the mat. Even though we know or we've read that the mat is not that important, well, one of the mottos is you don't exaggerate in health. So this is basically what we're doing in general scenario. As you can see, the basic things are simple things, and they have been working for us. I think that's it, Patrick. Well, this is, again, road disinfection, rest area disinfection, how we communicate some things, or how we communicate that we're having seminars or webinars within the same projects. The next one, and that's it. That's it.
Thank you. Thank you very much, Héctor. Thank you very much for being available today and for sharing this insight and for showing us this machine that measures the temperature. Thank you very much. To everyone in the audience, if you have questions for Oscar, please write them down in the chat, and they will be handled by Christos later on today during the question and answers part of our webinar. Our next panelist is Jim Tymon from AASHTO in the USA. Thank you very much, Jim, for being here today, and the floor is yours.
Well, thank you, Patrick. I do appreciate you having me here today. As Patrick said, my name is Jim Tymon. I'm the Executive Director for the American Association of State Highway and Transportation Officials, or AASHTO. And I'm also serve as the chairman of the PIARC National Committee for the U.S. So Patrick, if you can go to the next slide there. So I'm sure many of you are familiar with AASHTO, but for those of you who aren't, we are a not-for-profit organization that was founded over 100 years ago. And we represent the state transportation department. So the 50, from the 50 states and the District of Columbia and Puerto Rico, we have the responsibility of representing the work that the state departments of transportation do here in the U.S. And again, our organization also serves as the PIARC National Committee of the United States of America. So the next slide. So again, as we're all here to talk about today is the impact of COVID-19. So I'm going to address some of the impacts here in the United States of America, but wanted to talk a little bit before we get into the impacts on transportation, just where things stand with the virus and the pandemic here in the U.S. Today. As of today, about 215,000 people have died from COVID-19, and nearly 8 million people, nearly 8 million cases have been reported. So people have been diagnosed with the virus. The number of COVID deaths peaked in mid-April, and the number of COVID cases peaked around mid-July. But it's important to note that one of the things that we are seeing here in this country, and I think we're seeing across the globe at this point, is that we're starting to see another uptick in the number of cases, as well as the number of deaths. So this next wave that we're going to be talking about here in a few minutes is certainly on the horizon. We're starting to see those numbers tick back up from the highs that we had in mid-July and in April. We aren't up to those numbers yet, but there is obviously concern with public health experts that we are trending in the wrong direction, and that there is a lot of concern that we will have a new wave of the pandemic later this fall and into the winter, that could be as severe or more severe than the highs that we've seen earlier in the year. So the next slide. So to talk a little bit about how COVID-19 has impacted transportation, in April, we saw that vehicle miles traveled, the amount of travel that folks were doing in their cars was down more than 50% compared to last year. And that was, again, probably the height of the impact when it came to vehicle travel. At that point, many states across the country were under stay-at-home orders, where we were encouraging or requiring people to stay at home and to not do any unnecessary travel. And as a result, we saw about a 50% decrease in the amount of traffic on our nation's roads. But as we got into the spring and summer months, we saw that traffic rebound significantly. And at this point, we're only down about 10% compared to 2019. But it's also important to note that as we look at other modes of transportation, that they have been impacted more significantly from a ridership or a travel standpoint. In April, when we looked at the mass transit or public transportation ridership numbers, there was a decrease of more than 90% compared to last year. And again, that still has yet to rebound. We've seen a small increase in public transport ridership here in the summer, but we are still, in most transit systems, we're still below 80% of where we were last year from a ridership standpoint. We also have not seen a significant rebound in our air travel or in our intercity passenger rail travel. So again, to some extent, our road and highway travel has rebounded much more so than we've seen in other modes of transportation. So the next slide there, Patrick. So what have we learned since the pandemic really hit here in the U.S. in March? You know, I think the number one thing that we learned is that the virus was impacting each state differently, and how each state reacted to COVID. And again, this is more from a transportation perspective. One of the starkest differences that we saw between how each individual state handled the virus and the impacts were in construction projects. Some construction projects, states pulled back on the projects that were scheduled to move forward with, or they stopped construction for fear of spreading the virus amongst construction workers. But in other states, we saw them take advantage of the fact that there were fewer people on our roads, there was less traffic, which gave them more of an ability to be aggressive with their construction projects, and they accelerated the timeline for some of them. They worked more hours on existing facilities if they had construction projects there, because there weren't as many vehicles traveling on those roads, and that gave them the ability to work in a longer time frame on those facilities because there were fewer cars at that point. The other thing that we really noticed during the pandemic, at the height of it at least, was as traffic decreased, we saw that driver behavior changed as well, and that we saw a big increase in the amount of speeding, the number of crashes, and the number of fatalities on our nation's highways. So to some extent, we've learned that the congestion that we had, the roadway congestion from a traffic standpoint that we have come to accept as normal in a lot of our urban areas, actually was having somewhat of a safety impact in that it was slowing people down. It didn't allow people to get up to a high rate of speed. So when we eliminated that congestion because there were fewer people on the roads during the height of the pandemic, we saw that drivers were picking up their speed. They were exceeding our speed limits. And when they did have crashes, they were usually more severe than they were prior to the pandemic. And as a result, we were seeing more fatalities than we would under normal circumstances. What we're seeing now is that, again, as I mentioned, that since this summer, traffic is returning up to normal levels. We're about 90% to what we would be in a normal in a normal year. But what we've seen is that the travel patterns are changing. A very significant number of the workforce here in the United States is still working remotely, still working from home. So while we're seeing the vehicle miles traveled numbers rebound to roughly what they were in the past, we're not seeing it as much in the same time periods of the day as we normally would. We aren't seeing a lot of congestion in the morning hours and then in the evening hours when people are going to work and coming back. We're seeing it actually spread out more throughout the day. And we're seeing a little bit of even a peak in travel around the midday. We're finding that people are using maybe that midday lunch hour to go out and run errands and do some things that they otherwise would have been in their workplace for. But when you're working remotely, you might have a little bit more flexibility to do that. And the other thing I would say that we've learned since the height of the pandemic is just how resilient and dedicated our transportation workforce is. Again, transportation was one of those activities that was deemed essential by the United States government and was allowed to continue to move forward during when a lot of other activities were halted. So, when we had State Department of Transportation workers who are responsible for operating and maintaining our nation's road and highway network, those people were still coming to work every day. They were still going out there and doing their jobs when most other people were staying at home because of efforts to contain the virus. And the fact that those people were willing and dedicated to their jobs, they were coming into work every day, and to some extent putting themselves at risk just to do those jobs, really, I think, highlighted the fact that how dedicated they are and how resilient they are, and that the organizations that work on these issues are. You can go to the next slide, Patrick. So, well, what are we doing here to prepare for that next wave? This is extremely important because, as I mentioned earlier, I think that we are definitely going to see another wave here in the United States. And one of the things that we are trying to do is be better prepared for some of the operational challenges that we know that we are going to face. State DOTs pivoted very quickly to be able to utilize intelligent transportation systems and other technology to monitor and manage the operations of our road and highway network. And again, we're going to be ready to deploy similar strategies as the virus begins to uptick during the fall and winter here. We're also better, I think, prepared to utilize, say, digital messaging signs or variable messaging signs to get the word out to the traveling public if there are outbreaks in certain areas, or reminding people to take precautions from a virus standpoint, reminding them to socially distance, to make sure that they're wearing masks. We had been taking a very strict approach to utilizing those highway message signs in the past, where we said they could only be used for operational concerns or to relay information related to travel to folks on our roads and highways. And we've moved away from that, especially during the pandemic, and using those message signs in certain cases to get other information that's important to the public out, including in this case, reminding them to be responsible and when it comes to your actions regarding the virus, but also, again, being able to convey information to them if we're seeing an outbreak in certain areas of the country. One of the areas that we also struggled with, I would say, back in March was the permitting process to utilize heavier trucks to deliver essential supplies and equipment. Here in the United States of America, we have the permits are really handled on a state-by-state basis for heavier trucks. And we found that at the height of the pandemic, when we were trying to move some of that essential equipment, whether it was medical equipment or if it was even groceries, that we had to make sure that we had a better process to make sure that those permits could be coordinated so that if you were delivering something across multiple state boundaries, you didn't have to get 5 or 6 different permits. And we worked during the early days of the pandemic to better improve that process. And I do think that we are better prepared to handle that situation as the next wave, as we're faced with this next wave. We're also going to be better ready to accelerate projects if necessary. Again, I mentioned that some states were able to move forward quickly and accelerate projects as traffic volumes decreased. And we're implementing new ways to keep projects on track that are in the planning process. One of the things that we found was as these stay-at-home orders were in effect, the public involvement process for transportation projects really slowed. We weren't able to have the public meetings that we usually have to get input from the public as to whether or not a project should move forward. And we've switched essentially to utilizing virtual platforms like this in order to get that public input. And I think we'll be better prepared for that as the next wave hits. And I'd also point out that the next wave is going to occur here in a different season here in the United States, and that brings different challenges as well. As we're dealing more with the winter months and snow and ice issues, those are different challenges for us to face. But again, state departments of transportation are preparing for that so that they can handle it. Again, from construction and maintenance practices, we've changed some of those and from the lessons learned at the height of the pandemic to ensure worker safety, making sure that everybody has personal protective devices and is wearing masks, avoiding close contact for construction and maintenance workers, making sure that only one person is using a vehicle or a piece of equipment when possible. And again, making sure that from a hygiene and a sanitation standpoint that we're doing everything we can to make sure we're keeping our workers safe and healthy. But also making sure that for our office workers that are able to work from home, that we're maximizing work from home and telework. You saw very quickly that a lot of state departments of transportation had to pivot to allowing their office workers to work from home. And the fact that I think within a couple of weeks, they were able to say distribute laptops and implement policies and procedures for their office workers to work remotely. The infrastructure is now in place for them to continue to do that. Most, I think, office workers with state departments of transportation are still working from home most days. And I think that as we see another uptick in cases with the virus, I think state DOTs will be better prepared to transition back into full-time work from home or teleworking if that is necessary. Next slide, Patrick. From our research on the effectiveness of the measures that were deployed, we were working very closely with the Transportation Research Board, TRB, here in the United States on several projects. I've listed a few of them here. We've produced a guide for transportation agencies on how to manage your response to a pandemic, essentially a playbook that outlines best practices. We're working to identify on a research project to identify supply chain problems and solutions for how to get essential goods to market. We're developing procedures for relaxing truck weight restrictions for the emergency supply deliveries, as I mentioned earlier. Identifying best practices for the use of virtual platforms to engage the public in decision making. This is that issue that I brought up with virtual public meetings. And then again, also identifying effective tools and practices to maximize teleworking and work from home. Okay, the next slide, Patrick. So finally, just to talk about where things stand here in the USA related to utilizing investment in roads and infrastructure for economic recovery. Really to date, the COVID relief funding that has been provided by the federal government here for transportation has been more focused on operations. So you've seen funding go to public transport or mass transportation. You've seen it go to intercity passenger rail. You've seen it for airports and airlines. Really not funding for construction per se, but just funding for operations so that they could continue to provide those services, to continue to provide bus service and rail service. Because so many of those transportation modes or agencies rely on fare box revenue from customers that without some federal government assistance, they were not going to be able to stay open. And the federal government has really focused their relief up to this point on those types of operational assistance. We haven't seen money provided for construction or for roads and highways yet. But we are asking the federal government for $37 billion to help replace some of the lost revenue that we've seen from a decrease in driving. We estimate that states have lost about $16 billion in revenue from gas tax revenue that they rely on to fund highway construction, maintenance, and operations just in the last 6 to 7 months. And we anticipate that it'll be about $37 billion impact in lost revenue for states over the next 4 to 5 years as we continue our economic recovery from this pandemic. And obviously those numbers are going to be subject to change if we see another spike in the virus here in the next few months, and we revert back to the stay-at-home orders that we had earlier in the spring. But we are hopeful that Congress will pass some type of economic stimulus package that includes road funding in 2021. As many of you probably know, we are in the midst of a presidential election, as well as a significant portion of our legislature is up for re-election as well. And I think that some of the politics associated with those elections here coming up next month have impacted our ability to get some type of a economic stimulus package going. But I'm fairly confident that in the next calendar year, they will provide some type of economic stimulus package, and I am confident that it will include money for road construction as a way to help stimulate the economy. So with that, again, I think that's my last slide, Patrick, and look forward to any questions that folks have here at the end. Thank you.
Thank you very much, Jim, and we do hope that infrastructure will be included in recovery packages. Again, to everyone, if you have questions, that's really welcome. Please ask those questions in the chat channel, and they will be directed to the relevant panelists during the Q&A session later. Our third panelist is Bill Halkias from Greece. Bill, thank you for being here with us today. The floor is yours.
Thank you very much, Patrick. Thank you, PIARC, for inviting me to talk about this pandemic and how it has impacted the motorway traffic. And when I talk about motorway traffic, I'm talking about a particularity. We talk about tollway traffic that has been impacting toll roads, not only in Greece, but everywhere, at least in Europe. The particularity of that is that restrictions imposed by the government made impossible for some people to travel and obviously use the toll roads. But at the same time, the financial consequences of the pandemic also impacts the ability of people to pay toll and travel on our roads. Next slide, Patrick. Next one, my picture is there, and my CV, you can log in later on. All right, so let's talk about the European toll road network, which has been developed on a concession basis. So what you see in light blue are the countries, the European countries, that they are part of this road network, which we call ASECAP. We are comprising of about 87,000 kilometers, and the members are national associations. So we got 16 countries, all EU countries, with the exception of Turkey and Serbia, that are full members. We have 3 other EU countries that they are associate members, like Germany, the Czech Republic, and Slovenia, and 2 non-EU countries that they're associated with us as associates, Russia and Morocco. And Ukraine is also as a supporting member. Next slide, please. So let's take a look on how the European tollways were impacted. And those are data recently reported to ASECAP by each one of our members. What you see in there is the reduction of the ADT traffic between January and June. So that's the first 6 months of 2020 versus 2019. And you will see that the highest losses were reported by Roads of Serbia, representing Serbia, of course. And immediately after that, it is Sunebelt. Sunebelt is Denmark. It's ASFA. ASFA is more than 30%, is France. And then you have lower countries. That was on the left side of the diagram. If you switch on the right side of the diagram, there are 2 colors there. It's the first quarter of 2020 versus 2019, and the orange is the second quarter of 2019. So because the pandemic spread out throughout the continent in various waves, some countries were impacted early on as February, but most of the, we'll say the wave hit Europe in the second quarter of 2020. You will see the big differences there. You see, again, a reduction of about 60% compared to the 2019 numbers on the Sunebelt, representing Denmark, then following by ASFA, representing France, by 60%. So that's the traffic evolution. That's what traffic has done to the European toll roads. Next slide, Patrick, please. Now, if we compare passenger vehicles and heavy good vehicles, you will see a big difference. You will see that we have reduction if we compare the ADTs as measured by ASECAP. And what we call here as ADTs as measured by ASECAP is the mainline traffic between 2 interchanges multiplied by the distance of the length between those 2 interchanges. And then we sum up all the ADTs, the mainline traffic, over the length of the motorway or the tollway, and then we divide with the total length. So in reality, we're talking about ADT per kilometer. So you see here what's happening. In the first 6 months, we had a higher increase on passenger vehicles. But when you look on the right side of the diagram, where we have the ADTs for the heavy vehicles, you will see there that the impact has not been that big. Logistics and the chain, the transportation chain, that it is being maintained with heavy good vehicles, maintain their traffic. Next, please. The source of all this information, of course, is ASECAP. Now, let's go from the European continent down to the Greek toll roads. Now you see the map of Greece, and the toll roads have been developed mainly, or not only mainly, I will say only in the mainland. We don't have toll roads in the islands, and we don't have motorways in the islands. So we are an association that is comprising from 6 private concessions, 7 private concessions if you add the toll bridge of the Rio Anterior, a suspended bridge, and the one public entity, it's Egnatia toll road on the northern part of Greece, which is about to privatize. So the COVID has impacted the time schedule of that privatization. What you see in black in the center of the country is Attica Tollway, the agency that I represent and I work for. Next slide, please. Now that network comprises of 2,300 kilometers. It's all of that by using tolls. 7 of them concessions, but all of them tolls. So if you go month by month in all the 8 toll roads in Greece, you see what's happening. January and February, we were hearing about COVID, but it has not impacted the country at all. So you see increases in toll traffic versus 2019, ranging from 4%, which was the lowest in Attica Tollway, which is a suburban, which is an urban toll road, to 15% that Egnatia was enjoying in the northern part of Greece. And then we start with the pandemic. And you see that in March, everybody is down. Everybody is down and considerably, totally 39%. And April, when we had a full lockdown, you see that every toll road is down by about 70 to 80%, and overall 74%. And that 74% now is starting to be to ease up. And in May, we are 39% down, and little by little, we open up the country, tourism and everything else, it comes up. And in August, that was the lowest decrease, July and August, of 10 to 11%. But then September comes back, the country is about to see the second wave, and now we are going up to 15%. So January to September, we are down 20% approximately. What this has cost, about 96 million euro, including VAT, has been lost in the period, in the 3-month period, March to June 2020, for all Greek roads. Now, 7 of the toll roads are concessions, and you can understand the impact that these losses have on concession projects. Next slide, please. Now, if we go back month by month and compare the traffic increase or decrease, and on the right side of the slide, we report the GDP change, you see what is happening. You see increases in January and February, and then we take a big dip, which is starting in March and peaks in April, and then with easing up, we're going a little bit up in May, June, July, and then August and September, we level off, but start going down again because of the second wave being in line. So the 11% that we lost in August becomes 15% in September. Now, on the right-hand side, you will see the changes in GDP. And in the first half, we lost about 8% of our GDP. And in toll roads, we have observed here in Greece that we are about even with the losses or increases of GDP. If GDP goes up 3%, toll road traffic goes up by 3%. If GDP traffic goes down by 5%, toll road traffic goes down by 5%. So that's something that we have to consider for the future. Next slide, please. So if we see the evolution of traffic, I will not go over one by one the traffics, But I will again repeat and remind you the picture that we saw for ASECAP, for the whole European continent, that passenger vehicles and heavy traffic have a different behavior. So from January to September, we're down about 22% in lower traffic in passenger vehicles, but only 9% in heavy good vehicles. And some of our toll roads really in September have reacted very well with traffic almost coming back. Next slide, please. Next slide. All right, so let's go one slide back, please. All right, now let's focus on an urban toll road, which is Attica Tollway, which my agency is operating. Now that's a 70-kilometer toll road acting as the periphery of Athens, the ring road around Athens, 70 kilometers in length, 39 toll stations with 195 toll gates. Literally, there is toll in each and every entry. You cannot get on the road unless you pay a toll. And you pay the full toll no matter the distance. That was a decongestion regime imposed by the concession contract that said, let's keep traffic out if they don't need to save, to make a long distance and to save substantial amount of time. So the toll road was fully operational in 2004, although it opened in stages between 2001 and 2004, fully operational in 2004, and traffic was going up ever since, up until 2009 when we reached 307,000 vehicle entries per day. That was the highest. And then what do we have? We have a financial crisis that has impacted only Greece. And what's happening here, from 307,000, we keep losing traffic, going down to 196,000 in 2014. Then, not that the crisis is over, but the worst was behind us, and now things started going up until 2019. And in 2019, we reached about 236,000 vehicle entries per day. And now we are in 2020, the first 9 months, where we have the pandemic impact, and now we're 185,000. So you see how financial crisis and COVID has impacted this urban toll road, which is a main metropolitan area around a city with sleeping communities to the left and the right, the north and the south, and people commuting to go to the center of Athens, which is the major employment area. Next slide, please. So if we go into the next slide, you will see the numbers month by month. But you will also see reporting the lowest number we ever recorded, which was the Easter Sunday of 2020, where we had 93.2% reduction in relation to 2019 traffic. But you see the changes in ADT on the last column, where in April, with the total lockdown, we lost 71% of the traffic. In July and August, when we all opened up the country, the losses were 9% and 7%. But then everybody comes back from vacations in the Greek islands in September with opening of schools and everything else. And the second wave of the pandemic, the losses are starting to go up, 12%. So in overall, from January to September, 21% of the traffic was lost on this urban toll road. Next, please. Now, I will not go over one by one the dates, the critical dates, but the pandemic was first declared at the end of February with the carnival festivities canceled, and then little by little, the various economic and social activities were restricted, and we went to a start of lockdown, a total lockdown on the 23rd of March, which lasted up to the 3rd of May. And then little by little, we were opening up the country, and now we are into the phase where we are bringing back again, little by little, the restrictions. Next slide, please. So if we compare traffic from that date, the 28th of February, to today, and in orange we show the 2019 traffic, and in blue the 2020 traffic, day by day. Those are day by day, and of course the peaks are weekdays, and the caves, the V section are the weekends. You see that during the total lockdown we lost a lot of the traffic, but then traffic little by little was coming up, but we're still below. Next, please. Some pictures, right, on a toll station. You see on the left side, March 5th, which was at the beginning of the lockdown, and April 2nd on the right side. Literally only one car versus the thousands of cars waiting in line to pay toll. Next, please. And an urban tunnel of about 1 kilometer long. On the left side, lots of traffic. Oh, everybody wants to get into that tunnel to bypass. And then on the right side, on the 2nd of April, no traffic at all. Next, please. So we say the pictures are 1,000 words. So what do we learn from that? We learn how to apply crisis management guidelines. We always had them there, but these crises were there to address either floods or snowstorms, events that they were lasting 1 or 2 or 3 days. Now we had an extensive time, and we learned how to apply crisis management guidelines. We digitized a lot of our procedures, and we have found out that we can carry out some of our work remotely. Before the pandemic, no one worked remotely. We provided remote access to employees to facilitate teleworking. Before that, we were not doing it at all. We maintain business continuity by applying alternative plans. We use call and courier techniques and stuff like that. We expand the digital payment using cards at the toll stations, transponder top-up via card or web banking in order to facilitate the automatic payment of tolls. Next, please. So where we are now, we have 20,000 cases as of October 7, 424 deaths. This is incredibly good if you compare with other countries. Local restrictions are still in place. Wearing masks is obligatory. Next, please. So what are the future concerns for the future? And this is my last slide. I pose questions. Is COVID going to change travel behavior that has an impact on traffic projections? We're in the midst of doing a new concession, as I said at the beginning of my presentation, Egnatia in the northern part of Greece, right? The pre-qualified groups will consider that. They will go to say, wait a minute, what's traffic predictions going to do? How the bond markets and the lenders will evaluate new projects. I know in another transportation project in Athens, the airport, which was going to sell, the government was going to sell the stock-owned by it, that it was postponed because the bond market and the financial market are still concerned. Last but not least, how the disruptive technologies that we wanted to use, such as connected autonomous vehicles and mobility as a service, were going to impact these traffic projections. So with that, I think the last slide says thank you to everybody. I finished my presentation and I'm available to answer any questions anyone may have. Again, thank you all.
Thank you very much, Bill, for this really detailed presentation. I really appreciate the fact that you're presenting that with your feet on the ground, and you raise really valid questions that I think we will address later today. Feel free to ask questions, everyone. Our fourth panelist is José Manuel Blanco Segara, who is a distinguished member of the PIARC COVID-19 response team, a member of our committee, Committee 1.1, and also working, mostly working in Spain with a ministry called MITMA. José Manuel, the floor is yours.
Good morning, everybody, or good evening, whatever you are. Thank you very much to the organization for this opportunity to explain all of you the Spanish seminar we organized several days ago, the 30th of September. And for me, it's a challenge to summarize a so long seminar. Well, my name is José Manuel Blanco. I am the Spanish Secretary of the Technical Committee 1.1, Performance of Transport Administrations. Next slide, please. That's my slide presentation. We are rather short of time, so let me introduce you the 4 speakers of the Spanish seminar. Bianca Bianchi is a senior transport specialist for Latin America of the World Bank. She is from Brazil, is working in Washington, and she speaks a wonderful Spanish. It's a very international world we live now. Second is my General Director of Roads, Javier Herrero, from MITMA. MITMA is the new name of our ministry. It's the acronym of, translating to English, Ministry for Transport, Mobility and Urban Agenda. That's important that now the concept of mobility and urban agenda is now with us. Third one was from Chile, the General Director of Roads. I've written the Spanish words in italics. Vialidad, called in Chile. MOP means Ministry of Public Works. Jaime Retamal. And last, Mr. Cedric Ivan Escalante is the Vice Minister of Communications and Transport. This is the translation I've done because he's the subsecretario, but subsecretario in Spanish for the foreigners is a rather confusing word because in some countries, like in Mexico, means Vice Minister, and in other countries, like Spain, means the individual who in the ministry is in charge of all the internal questions. Well, next slide, please. Well, I think that you in your jobs do like we do in my country. When you have a report, we go directly to the conclusions. Well, as I said to you, the seminar was very long, 3 hours. More than 100 of slides, a lot of questions. So I encourage you to visit the video. If you understand some of Spanish, the presentation will be translated, of course. And here are the main conclusions for me. The first one is that the post-crisis recovery is an opportunity for the re-prioritization, innovation, new technologies, and new goals, rethinking always in logistics and mobility. Also, we have to incite everybody, to media, to society, to our governments, in the idea that investment in roads has a rapid and widespread positive economic and social effects. But the challenge, as all of us we know very well, is to obtain the necessary funding. But there are mechanisms for this, and we have to fight for them. Of course, we also need to communicate that much remains to be done. It's not all done. Much remains to be done to improve connectivity, service levels, and to respond to the ever-increasing demands and expectations of society, users, stakeholders, and it's not written, I'm going to say, our government, who always want more with less money. So let's communicate it in a clear, constant, coherent, and convincing way. Let's please. Next, please. Well, here I'm trying to summarize the presentation of the World Bank. COVID impacts, she insisted in the commitment of the World Bank to all the countries of the region, of Latin America region, to collaborate against this unprecedented economic downturn of 7.2 in Latin America, with a declining exports in volume and revenues. That means poverty for millions of people. And she insisted in, the major impact on women, especially because usually they are working in non-official ways, and usually they had to take care of people who is sick and children and so. Thinking of recovery period, World Bank estimate between 15 and 14 months, depending if the economy of the country or the region is more or less agricultural. If agricultural, the recovery period will be shorter. If industrial, we need more time. But they have observed, of course, a great acceleration of e-commerce, especially in large cities, but the need to strengthen internal road networks. So the idea is that Latin America is suffering infrastructure gaps. Why? Because in the 80s, the investment, adding public and private investment in infrastructure was around 4%, but now it's less than 2%, whilst in East Asia, for example, it's around 7%. And that has consequences like low logistics performance indices. So she said very clearly the challenge was there and COVID has made them worse. Next, please. Well, also she insisted in the role of roads in economic reactivations. The infrastructure has proved to be fundamental in responding to the pandemic, but now what is going to happen? Because the government needs money for many other things. Well, but we know very well that governments need to generate employment in the short term. So now, in this moment, now she told us that World Bank is updating the impact of road inversion. These figures you see here are figures of the year 29. So they are going to update it. But anyway, it's very clear that to invest in road maintenance create much more employment than in energy. Several thousands of people against just 100. What kind of types of projects the World Bank is financing? Well, of course, they are focusing subnational or national employment generating projects. And how they decided? Well, after identification mission and several revisions, they considered all these aspects, and she insisted in the need of a strategic approach improving competitiveness and efficiency of countries. The World Bank collaborates with clients in awareness, regulation, data, and if it's needed, improving design and provides technical support. Somebody asked, how much time do you need from some country asks your help and then the project is starting? And the answer was depending on the country, depending on the paper, depending on the authorization, we are talking from several months to several years. Here in my presentation, I'm adding, as I said, the presentation text and the answers text, because I understand that many of you don't understand Spanish, so you don't know, you can't understand the video in Spanish. Finally, here are the projects that they work to financing, especially in the bottom of the slide. Well, next, please. Going to Spain. Our general director explained the starting situation. Well, our situation, as you know, is bad. The GDP has declined in the second quarter, not the 7 or 8% in Latin America, but 17, almost 18, as you see. The unemployment and temporary layoffs, we call them ERTE, is the Spanish word for this, Expediente Regulación Temporal de Empleo, are increasing. The public deficit is increasing. Well, the good news is that road transport has continued smoothly. Yeah, as you know, we have the third in the world high-capacity road network. And thinking on how to financing, we are going to speak, he explained, the 3 ways we have. The first one, of course, budgetary, but now it's insufficient, among other reasons, due to the recent expiry of toll road concessions. So now they are being supported by the DGC, the Directorate General for Roads, Dirección General de Carreteras. Here you have the figures of last year. As you see, more budget for maintenance, conservation, we say, than construction. But now we are very concerned that the public deficit will lead to less investment in infrastructure. The budget for next year is in the pipeline, and we are sure that maintenance will be prioritized, but we don't know in this moment what is going to happen. We still have many works under construction. So we have prepared a second way, the investment through PPPs, through an ambitious road investment plan, PIC, we call them, Plan Inversión de Carreteras, for a period of 25 years, an amount of 5,000 million euros, and ready to be launched for these 3 goals that you have here. To complete the European road network in Spain, capacity and functionality on peri-urban areas, and updated the first autovia, the first double carriage road that we did, they need to be updated. Next, please. The model of this plan will be availability payment modified by indicators, and we have readjusted the risk distribution between the concessionaire and the state. For example, expropriation will now be paid by the state, not by the concessionaire. And the third one, everybody is speaking about it in Spain now, is the next generation European Union. It's a European recovery instrument for relaunching economy. And the centerpiece is the RRF, Recovery and Resilience Facility, with grants and loans. And around 140 billion euros will be allocated in Spain. It's a great opportunity for us. Our approach is try to relaunch economy through modernization and digitalization. And we are thinking in 1.7 billion for these 6 goals. Let me just highlight the first one, almost 1,000 million for rail safety improvement and modernization. We have, remember that we have a lot of mountains, 500 kilometers of tunnels we have. Also sustainability and energy efficiency. And the last one, when you see in Spanish bus, VAO means bus and vehicles of high occupancy, we have a pilot project trying in a very dynamic way to give more facility to the vehicles with more than, a cars with more than one individual in it. Next, please. Chile. Well, Chile is in his plan that I translated to English, step by step, Chile is recovering. He explained the current road situation, set out the mission, the vision, and the strategic objectives of the Chile's Directorate General of Roads, Dirección of Vialidad, the very important role of the national development in the mid and long term, because its budget exceeds more than 60% of the public works ministry. They have a huge national network. I always say in Europe that Chile is so big that you put the south top of Chile in the south of Europe, the north will be Moscow. So it's an incredibly big country. And they are very used to fight against all kinds of natural catastrophes, but now they are fighting with a catastrophe against people and activity. So the state of catastrophe was declared on 19 March. Now they are in gradual deconfinement, and only they stress that he stressed that only 6 or 7% of the 1,000 ways have required reprogramming. They have tried to keep the road activity always with non-presential work as possible and flexibility. But the question is now, what will the roads be like after pandemic? Because the challenge, of course, is to continue implementing and maintaining. Well, they have the special focus on what they have identified in the country as a structuring road network and critical road network, and they are trying to improve it, what they call the 3RR. Translating to English, I found these 4 words mean the same that in Spanish: robustness, redundancy, rapid response, and resources. Next, please. Well, this is just a slide to see that it's real. It's clear that Chile is very used to fight against volcanoes, tsunamis, earthquakes, whatever. Next, please, big fires. Well, the contribution of roads to Chile's economy recovery through this plan, they are using massive, the ministry and other ministries are using massive tenders for designing, because they insist in the need of help to the designing companies, the engineering companies, work and services to revitalize the economy. Here you have so many tenders they are launching, and the investment projections for the next year are good, because even the government priorities, of course, is to help families and companies. The next budget is higher. Look the figures. This year they have 1.48 billion. Next year, almost 2 billion. And as he said, it will mean for them a great management effort. And this is a quote I take from his words, speaking about how this economic crisis has been shocking, intense, global, and uncertain, but they are learning. There are many uncertainties, but they are working in a coordinated way for reactivation and updating protocols of new normality. Next, please.
You have about 1 minute, José Manuel. Thank you.
Thank you very much. I'll go fast. The last one was from Mexico. The first speaker today is also from Mexico, so I just say the main ideas from Mexico. He explained the good situation of in Latin America, of the competitiveness of all related with roads, especially in connectivity, in the round 22, how the roads are the main mode in Mexico. 95% of people go by road. This 55% is because there is a lot of export through sea, but in the internal world, of course, is almost road. How huge is the federal roads, and also the state roads and the local roads? He explained the pandemic evolution. He explained the big problem they have had, but now the inflation curve is has not been clearly lowered, but taking into account degrees of contagion, number of deaths, and so, there is a light of hope. He explained the prevention measure for contractors and workers. The construction workers weren't considered essential works, so during 2 months they have time to discuss with contractors all the prevention measures. Teleworking, of course, is a measure to stay. Next, please. And he explained the situation all like in Greece, no? Greece fell down of traffic volume in tolls, not so much in the free roads. And regarding employment evolution, the unemployment has fallen down now. People are returning to work, and road is contributing. Here you have the figure, 100,000 jobs at federal level. That's very important. And next year, the budget will be higher, 2%. And they have now a road concessions program. They have started. They have done already 5 dual carriageway, and more dual carriageway works are coming. Next, please.
That's the
And
end.
that's the last one. Is just here for questions and answers. Has some of the main ideas that you afterwards you can read, because the time has finished. Just I want to highlight this one. Everybody had during the seminar the feeling that society and media are not clearly aware of the importance of the road networks because we are somehow invisible, and perhaps this is our responsibility. And that's all. Thank you very much, Patrick, and all of you for your attention.
No, thank you to you, José Manuel. You have been able to compact 3 hours of webinars in 15 minutes. Congratulations. And as José Manuel was saying, the presentations are available from PIARC's website. Our fifth panelist is Mark-Henry Rubarenzya from Uganda. Thank you very much, Mark, and the floor is yours. You have about 12-15 minutes. Thank you.
Thank you, Patrick, and thank you to PIARC for the invitation. This coming after I was also invited to give a presentation at a similar workshop in April when I did talk about the impact on and response of Uganda to COVID-19. That time it was just about a month since the pandemic had hit the country. So there in front of you is myself. I had research and development at the Uganda National Road Authority. I am also the first delegate of PIARC to Uganda. I coordinate a big research program of DFID in the country. I'm also a board member of the International Road Federation, and I'm active on the Climate Change and Resilience of Networks Committee of PIARC. Next, please. So I'll give some context of the Uganda National Road Authority. The Uganda National Road Authority is a semi-autonomous body of government. It is responsible for the management, maintenance, and development of the national road network. That's the strategic road network. We also offer advice to government on matters concerning roads, and we operate under the general supervision of the Ministry of Works and Transport. Next, please. So to put this all in context, let me give some background on the progression of COVID in Uganda and what the government has responded. It's worth knowing that in Uganda, we are actually still in the first wave. So everything that we're going to be discussing in this presentation should be looked at in that context. So in March 2020, immediately after the first case of COVID-19 was reported in the country, all public transportation was stopped. Private vehicles faced limitations on number of people that could ride in a car. That was quickly shut down a few days later. So we had a total lockdown, but importantly, trade continued. So cross-boundary movement of trucks continued to operate with restrictions on passenger numbers. While passenger air traffic was banned, cargo flights continued and continue to this day with restrictions on number of persons who could be in the plane. in order to support the COVID response teams as well as deal with personal emergencies, the government created centralized pools of government vehicles. And these were spread around all the country and based at the district local government headquarters. So these supported the country during the period. And then come June 2020, until now, the government has been gradually easing the lockdown. Of importance to us transport professionals, it's worth knowing that there was need to design specific SOPs for people who wanted to use public transport or motorcycles, which are very common here, because we had to build customer confidence that these modes of transport are safe again, as well as we had to protect the riders or the drivers and the passengers. So it was not until actually the beginning of this month that we got passenger air travel resuming. And as of 2 days ago, total number of cases were just over 9,000 with 84 fatalities in the country. Next slide. So in response to COVID-19, I will break this into two parts. One will be the national response, and then I'll bring in elements to show how this has impacted UNRWA or how UNRWA has interpreted that in order to support our operations. So the first phase has happened everywhere in the world is containment interventions, and this is in form of the lockdown, which I've just talked about. Now, in terms of UNRWA, what we did is we then mandated home working, so working from home or remote working. And I will talk a bit more about how this was operationalized. But being people who are also whose mandate is developing and maintaining a road network, you have to have people on the ground as well. So for our site staff, we did two things really. First, we constructed housing or found them housing in the vicinity of the road projects upon which they were working. And so this was to minimize their travel because the country was in lockdown, but as well to protect them because even after certain restrictions were lifted, we still don't want our staff traveling unnecessarily because it exposes them to risk, which we wouldn't want to do. We also limited the need for site meetings by introducing video technology. And this had the positive knock-on effect that now we could maintain perpetual records of these meetings in case of future disputes, but hopefully none will ever arise. And then we went into phase 2, which is really mitigation interventions. So as far as the government was concerned, there was a reprioritization of the budget because resources had to be released for the COVID response. And the National Planning Authority, as early as April 2020, proposed establishment of a multi-sectoral National Economic Recovery Steering Committee, as well as a creation of a Uganda Coronavirus Relief Fund. Those proposals still exist. But as far as UNRWA's interpretation of these mitigation interventions then, we had work from home measures institutionalized, and this was supported by a memo from the Ministry of Public Service, which said that there's a maximum of 30 staff allowed in any government agency. So in UNRWA, you will not have more than 30 staff physically based in office at any one time. And then we've continued the development of a project pipeline because starting in July, then we entered the third National Development Plan, which is 5 years. So we have continued the development and procurement of ongoing works. Now, this is definitely going to have an impact of supporting the recovery because there will be work going forward. So next slide. So then we get into third phase, which is really the post first wave, if you would want to speak of it that way. Like I said, we're still in the first phase. So a lot of what I'll then present here are proposals, again, from the National Planning Authority. Some have been implemented, many are not, but these are really proposals at this stage because we're still dealing with the first wave. So first is to increase funding to the agriculture sector across the entire value chain. Uganda is an agro-based economy. Increase health spending, increase funding for R&D. U.N.R.A is also doing that internally. Emphasize digitization and mainstream it across a number of sectors in the country. Ensure continuity of business ventures and industries. Support the private sector through the creation of a business stabilization fund. Implement export promotion strategies. And then this new normal presents a unique opportunity where the government could then go about setting in place developmental policies that are in the greater good of the country, but in the old normal, for one reason or other, would have been too difficult to implement. It's worth knowing that for the past 10, 20 years, infrastructure has been a government priority, and it remains a priority, and will be going forward into the economic recovery. Next, please. So specifically to the transport sector then, what has been the impact? Comprehensive research is yet to be undertaken to evaluate the effectiveness of these measures that have been put in place to fight the pandemic. What could be said, which is probably true of a number of places where you're from, there's extension of some bidding processes. Here it was permitted by the law under the PPDA. They made provisions. There's delays on some ongoing construction work. This could be also as well attributed to some adverse impacts on the supply chain of various resources, personnel, equipment, materials. And very importantly, in the case of Uganda, this has exposed the necessity of having a strong and vibrant local construction sector. Because in cases like this, such a local construction sector at least ensures that base continuity of ongoing initiatives. Next slide. So in April, I did mention to you a number of interventions that U.N.R.A had put in place to fight the pandemic. So now I can report on some of the impacts. So first of all, the business continuity management team, as well as management, have supported employee health and safety. That has been our priority. That remains our priority. So this was through definition and then enforcement of SOPs. We have created a safe workplace with a lot of sanitization, wearing of masks, and you get punishments if you break some of these SOPs, any of them. We put in place testing, contact tracing, and have supported the small number of staff who have been infected. Our business has continued. We haven't had any break in our ability to execute our mandate. And again, the continuity management team helped oversee a smooth transition to working from home and the remote working arrangement as explained previously. Next slide. So in regard to project activities, yes, some project activities were affected, as I said, but the pace of implementation has continued throughout. So resource limitations have been experienced, and this is in particular in regard to resources that have to come into the country. So in terms of, say, human resource, the expatriates could not get into the country when flights were not permitted, and then certain inputs that had to be imported into the country. When that could not be done, or could not be done in a timely manner, then of course that affects the rate of progress, but doesn't slow it down. this pandemic gave the opportunity for us to enhance and so to speak, maximize the use of existing technologies that UNRWA had invested in over the past 5 or so years. So remote working then introduced new ways of having to work and collaborate and interact within staff as well as with our external stakeholders. So this was formalized actually by the human resources team who set in place work from home guidelines so that there is clarity across the organization. And this whole process of working from home and the transition was supported largely by technologies that we had put in place. So platforms like the ERP platform, the e-government solutions, and several other platforms, some of which were already in place and fully operational, and some of which COVID presented the opportunity to ramp up their completion for their use. Next slide. So this is my last slide, and it's really kind of reflecting on what are the key lessons to date, certainly between April when I spoke and now. First, like my colleagues have mentioned, is that teleworking or remote working is a viable option, and it's here to stay in some form or other, even post the pandemic. It's got its efficiencies and its challenges, but it's here to stay in some form or other. We need to undertake comprehensive research to, first of all, inform any new COVID-19 interventions that we plan to take, but then to evaluate the ones that we have done. So I liked what I was hearing from my colleague in AASHTO, the work they're doing with TRB, and as the leader of research in the organization, this is something which we feel has to be done, but it's also at the national level that this has got to be done as well. We've also learned that our different stakeholders are being impacted in different unique ways by the pandemic, and because of this, then our operations are being impacted in different and not too easy to predict ways. And so this has helped us, this has necessitated us to up our game of risk management as well as stakeholder management. And I'm glad to say that all is well thus far. We've also noticed the need to be flexible and reprioritize our resources as need arises, particularly when the government has to reprioritize resources to free up resources for the COVID-19 exercise. So I think I'll close my remarks there, pass it back to you, Chair, and I can take questions later on. Thank you.
Thank you very much, Mark, and I'm really glad that we have the feedback from Uganda. That's really, really appreciated. Now we've reached the question and answers part of our meeting. This is unfortunately going to be a bit short because of time constraints, and it's moderated by our good colleague Christos Xenophontos. Christos, the floor is yours.
Thank you, Patrick, and I would also like to express our thanks to Héctor, to Jim, Bill, José Manuel, and Mark for their excellent presentations and for summarizing the work that is happening in many countries today. We'll start with a question to Héctor, relevant to whether you have experienced a spread of COVID-19 within your organization as a result of employees not reporting other fellow employees who were exhibiting symptoms, as it seems like this was the case, in another agency.
Thank you, Christos. Yes, especially at the beginning of the crisis, because people were afraid to speak out, even when they themselves had any symptoms, due to the fact that they didn't know what was going to happen with them. And as the crisis moved forward, what actually worked for us was tell and show, tell them or communicate what was going to happen, and then when they began seeing that we were not laying off anyone, we weren't reducing wages to anyone, they were more confident to speak out and basically speak out for themselves rather than others. But by having the assurance that they would have the support for either medical treatment or just if they were asymptomatic of their wages, if they were staying home through the process of healing, they become more also committed to everything and helping each other and speaking out if someone was feeling bad or someone had contact with people infected with the virus. So at the beginning, yes, but throughout the development of the crisis, they began seeing that what we said was actually what happened. So that tell and show helped us stop that kind of attitude or that kind of actions.
Thank you, Héctor. And Jim, the next question to you, how do you advocate for the inclusion of roads in recovery packages? And what are the factors that you find useful to bring forward?
Well, Christos, I appreciate that question. I will say, I wish I had a better roadmap for how to do that successfully, and that roads were not included in that first round of federal funding to address COVID. As I mentioned earlier, we saw our mass transit systems and airports and intercity rail and our airlines get funding, but not for road construction. I think we are making progress in making our case and talking about the fact that if by investing in our road and highway network, we're addressing some of our issues from a state of good repair. The fact that our roads and bridges are just not up to the quality that they need to be. So not only would you be helping from an economic recovery standpoint in creating jobs, but you'd also be repairing and replacing infrastructure that's really necessary to ensure that the economy is able to thrive as we come out of the pandemic. So we're hopeful that argument is one that is going to persuade lawmakers here in the United States to invest. Unfortunately, to be honest with you, again, in the U.S., I always have to remind myself to explain the fact that our approach to road construction is it's done more at the state level as opposed to at the federal level. We get federal funding, but it's really up to each of the individual states to select projects and to set their road construction plan. So again, to some extent, we've been our own worst enemies at the state level because states have been able to find a way to continue forward as best they can without having to stop or pull back on that many projects. Either they're going out and getting loans or issuing bonds to be able to replace some of the revenue they've lost, or they're finding other ways to move money around. So for these first 6 months, we haven't seen a lot of specific projects that have not moved forward. I think we will start to see that here over the next 6 to 12 months, and that should help our case. But again, we're hopeful that as we make the argument that investing in infrastructure not only upgrades the quality of our infrastructure, but also really helps improve us from an economic competitiveness standpoint, we're hopeful that argument is able to persuade lawmakers in this next round of stimulus funding or COVID relief funding.
And I would say, from the state employee perspectives, we are running into a situation that where we are actually running out of state matching funds. So that is going to be creating an issue very soon for a lot of other state DOTs in the U.S.A. So thank you, Jim. Bill, the next question to you. You mentioned that a new concession project was put on hold because of the crisis. What are the plans now?
Thank you, Christos. Thank you, everybody. If you saw the map that I presented, the HELLASTRON network, and the northern part of Greece, the brown color was associated with the Egnatia toll road, the ancient Via Egnatia that was connecting Rome to Constantinople. So on the footprints of the ancient road, a brand new motorway has been constructed with also 3 perpendicular accesses to the east-west main toll road, providing access to the 3 Balkan countries, Albania, Northern Macedonia, and Bulgaria. So here is the deal. Part of the financial crisis, financial support that IMF and European Central Bank and the European countries provided to Greece had an MOU. And in that MOU, the Greek government was obligated to pass the rights of on the toll road to a privatization agency that was going after that to call an international bid for concession of Egnatia Odos. That, because of the pandemic, has been postponed. It was going to be, the bids were going to be received in April, and it was postponed because of the pandemic to the end of the year for this upcoming December. Unfortunately, the government believes that they will not going to get good prices because of the uncertainty that exists on toll roads and toll road traffic and everything else. And you saw the numbers, 30% down on Egnatia. However, there is an imposition from IMF and the European Central Bank that says, we don't care. Basically, they say, get rid of Egnatia and privatize it. Now, if it wasn't for the, I will say for the MOU, I will say that this thing will have been, or it's wise to be delayed. On the other hand, a concession, another obligation which was to privatize 100% the airport, which is also a concession, and the government holds a percentage on that. In there, I will say, because of the extreme losses that the airline industry has imposed, there I will say the Troika was more logical, and they agreed to postpone the selling of the Greek state share until better financial conditions. So that's the examples I had from Greece, but I hear it that is also spreading out in brand new projects that they were about to start in other countries.
Thank you, Vasilis. And next question to Jose Manuel. During the Spanish webinar that you have last week, were any ideas exchanged about how to raise the visibility of the road sector with the World Bank and others?
What a question. Of course, we talk a lot about it. The good news is during the pandemic, all road administration have worked very well, but the bad news is that media and people in general, in bar, restaurants, conversation, prefer bad news. So let's remember that PIARC in our technical committee, dear Christos, you are the chair now, in the year 15, we made a good report on good governance, and in the second chapter, written by somebody who you know very well, Connie Yu, there is a chapter dedicated to the influence of media in creating perceptions with several recommendations that in brief means we must be engaged with media very strongly because we are too focused, that's something we recognize in the Spanish seminar, in working and not in communication. We have to ensure a well-resourced communication department, developing a communication plan, and the executive manager must accept and support this idea. That's very important. If not, we'll be like the elephant is in the room that you say in English, no, that invisible legend that nobody think on it only when a bridge falls down or there is a big problem. We are only news when we are bad news, not when we are good news. So other sectors, health, health, education, are for money, and we are very, very quiet, very silent, very, very kind.
Thank you, Jose Manuel. Our next question goes to Mark, relative to the public-private partnerships that you mentioned as part of your road framework. And Mark, do you think the private entities can play a role in the recovery process in the industry in Uganda?
Thank you for that question. First, let me put the context of my discussion before answering the question. So we're talking about the same thing. So the PPPs come from a proposal by the National Planning Authority that in ensuring business continuity of ventures and industries, they support the establishment of special mechanisms to enable PPPs to be viable. So it's really about setting a framework that is going to encourage the PPPs to thrive. And in the transport sector, PPPs would be seen as one of a basket of solutions to support the recovery. Because we all know that the pandemic is likely to cause economic shock to quite a number of people. And certainly it will then knock on to affect PPPs, because it's going to be placing burdens on stakeholders, burdens on users, burdens on the private corporate sector and the public sector. So what is important is to have frameworks and mechanisms that are then going to develop models that make PPPs funky, so to speak, that make them attractive. So as it is, I could say probably off the cuff that in places like Uganda, you could say PPPs are most suited to things like ports, water, and energy, because those have traditionally been very, very easy to predict. And I think they still remain even in other parts of the world. So, but there's going to be need for an influx of new money. So I think the thinking of the National Planning Authority is in that line. But we haven't yet like sat down as a road sector and say, okay, so how do we use this in order to support a recovery? So I hope that that answers the question presented.
Yes.
Thank you.
Thank you, Mark. And we have a few more questions which we'll forward to our panelists and see if we can provide some additional information when the webinar is posted on PIARC's website. In the interest of time, I am going to thank all of our panelists for the great presentations and information provided here today. Thank all of the attendees for being here and asking questions and participating. And I'm going to turn it over to Patrick with one last question relative to what else is PIARC planning to be doing in the future for this. Patrick?
Thank you very much, Christos, and thank you to all the panelists and audience members for the discussion. So if the question is about the next steps for us at PIARC, so we will continue updating the webpage, including with the recording of today's webinar and sharing the presentation. We are analyzing a survey that we conducted in September and October, and the results will be included in an in-depth report that will be published before December. So I hope you will all find that very, very interesting. We are planning new PIARC webinars. Well, this is one. The next one will be in French 2 weeks from now, so some of you may be interested. And we will put an emphasis, I think some of the panelists today mentioned that, on the evaluation of measures that were put in place. What worked, what didn't work, and why. And we'll be thinking on how is the new normal different and what are the new expectations from users, including shifts in traffic demand. I would like to conclude by thanking all members of the response team. You have their names and face pictures here. They've been doing an incredibly good job since March, and it's really a pleasure to be working with such people and to be working with panelists and with audience members such as you today. That brings us to the end of today's webinar. Thank you very much, and I hope to see you maybe 2 weeks from now or in future events that we organize. Stay safe. Thank you.